Good afternoon and welcome. My name is Tim Poe. I'm Director of Telehealth with the UNC Cancer Network. Thank you all so much for being with us today, January 26th, 2018, for our Community Lunch and Learn series on cancer. Let's see, a few preliminaries and then we'll get started with our lecture. If you need to reach us for any reason, best thing to do is give us a phone call, 919-445-1000. I will mention that we are having a few issues today with the media site live stream freezing up. If it freezes up on you, I suggest that you refresh your browser. If that doesn't work, call our team at 919-445-1000 and they can give you suggestions for a few other viewing mechanisms. But hopefully that won't give us too many problems today, and we'll address that so that we hope not to see that problem occur again. Certainly in the future. All right, you can email us at unccn@unc.edu as well. We're on the web at unccn.org, on Facebook, on Twitter, and on YouTube. At our site, you'll find over 200 different oncology lectures and lots of information about future lectures as well. So we're going to do a poll, as we do for each one of our lectures. We'll start off with a quick poll at the beginning and then use this same Poll Everywhere tool for questions and answers at the end. So a couple of ways you can connect to this. You can go to pollev, POLLEV.com/UNCCN, and then you'll see the questions on the web, and you can respond to those there. You can also text the number 22333 with the letters UNCCN. And if you would, please, if you think there's any chance at all you'll want to ask a question, go ahead and do that now. Text to the number 22333 from any phone with texting capabilities, the letters UNCCN. You'll get a quick response back saying that you've joined Poll Everywhere. You only need to do that once today. Now, our first question, which is an anonymous question, the National Cancer Institute designates AYAs as people between the ages of, and take a shot at this. See, you may know this already. If you're not quite sure, it's an anonymous poll. Take a guess. Option A, if you wanted to send in the letter A, would be if you thought that age range was between 5 and 15 years of age. If you think that age range is between 15 and 39 years of age, you'll put in option B. If you think that's between 10 and 20 years of age, you'll put in option C. And if you think it's between 15 and 20, option D. Now, while we are waiting for you all to go ahead and share that polling information, I want to say welcome to our guest today, Lauren Lutz.
Thanks for having me.
Thank you so much for being here today. We really appreciate it.
I'm excited.
Got some introductory information about that we've heard about you. So you're Adolescent and Young Adult Program Director.
Yes.
And that's with, and you have an LCSW, and you're a clinical social worker with a passion for working with adolescents and young adults living with cancer, originally from the Midwest.
Yep.
All right, and completed your master's in social work at the University of Chicago, and directly after secured grant funding to create the University of Illinois at Chicago Medical Center's first pediatric oncology social work program.
Yeah.
Good for you.
Thanks.
You moved to North Carolina 6 years ago when your husband became a student at Duke, and you were an avid basketball fan prior to this event. Okay,
It's true.
Duke fan.
Yes.
Okay.
We support all kinds.
Anything changed there?
No, never.
No.
Never.
Okay.
Of course not.
All right. And then you were hired to the AYA program as the program director in October of 2015, and you've been meeting with patients and families and growing the program ever since. Work as program director focuses on patient care, psychosocial research, programming, education, and advocacy.
Yeah.
Does that pretty well sum it up?
Pretty much, yeah.
Okay, and tell us, for me and for our audience, what led to your initial interest and then a career in oncology?
Yeah, so I knew that I wanted to be in the field of kind of helping people. I wasn't quite sure what that looked like, and I happened upon social work. My mom was actually a young adult with cancer, and so I sort of grew up within the medical system and supported by nurses, doctors, and social workers who had taken care of my mom. So I was really comfortable in the oncology world and inspired by the work that those providers did and the support that our family received from them. So I had a hunch that that's kind of where I wanted to be, and that was 11 or 12 years ago, and I've been in that world ever since. So my hunch was hopefully correct. And I really love and am honored to be able to do this work every day.
Well, good for you. We're glad that you are. We're obviously this is extremely important work, and we look forward to hearing about the Be Loud Sophie Foundation.
Yeah, absolutely.
And we're very fortunate to have that right here in the Chapel Hill community.
Yeah, we really are.
So let's take a look at our poll. Let's see. I see a trend here.
Brilliant. Brilliant audience.
How are they doing?
Brilliant.
All right.
So impressed.
So spot on. So I wondered. I wasn't sure if everyone out there knew or not that when we're talking about young adults, we really are talking about through the age of 39 as being within that category.
Yeah. It makes a lot of people feel really good to know that under 39 is still considered a young adult. It's a nice tip of the hat. Exactly.
And that there's a whole set of commonalities from 15 to 39.
Absolutely.
Okay. Good. Well, I know you're going to talk more about that.
Yeah.
So without any more delay, supporting adolescents and young adults living with cancer, I'll pass this over to you for the slide advancement. And there's the mouse if you'd like to use that as the cursor. Right. And I'll warn you that mouse is a little touchy sometimes.
Right.
So typically, if I just hold it on the sides, it won't. Okay. Whatever mind of its own it has will be
No problem.
All right, Lauren, thank you.
No problem. So I want to talk today about some practical tips for friends, partners, family members, and community members who may know someone who is an adolescent or a young adult living with cancer. And I can't start this talk without speaking about Sophie Steiner, and this is the beautiful Sophie Steiner. She was a dancer, field hockey player, poet, lover of farmers markets and great food, and also happened to be diagnosed with cancer at the age of 14. She was treated here at UNC, and her family felt that she received fabulous medical care and loved the providers that they met here, but they knew that something was missing from Sophie's care, and Sophie was actually the one who kind of along the way in her treatment process said, there are not enough resources for teenagers and young adults. She was treated in the Children's Hospital, where a lot of activities and support are geared for younger kids. And she also knew she didn't necessarily want to be in the adult hospital, where many of the people that she would be with were much older than her. So unfortunately, Sophie died from her disease, and she asked that her family do something to honor her legacy by changing the way that teenagers and young adults were receiving care at UNC. And as a result of amazing support from the Chapel Hill and North Carolina community, the Be Loud Sophie Foundation was formed. We here at UNC are the direct benefactors of this foundation, which is an incredible gift. And what that has done has allowed us to start our adolescent and young adult oncology support program here. So I was hired 2.5 years ago to start that program and to begin to build it out. I'm very excited to announce that this past summer in July, we hired Dr. Andrew Smitherman, who everyone knows as Smitty here at UNC, to be our medical director of our program. He's a pediatric oncologist who is trained in medicine and pediatrics, so he is the perfect person to span that age range, which we'll talk a little bit more about. I want to tell you a little bit about our program so you have some context here. We serve patients ages 13 to 30 here at UNC. Sometimes we go a little bit over that 30-year mark, and we'll talk more about that designation of age as we move forward, but we provide clinical support to them. So as Tim mentioned, I'm a clinical social worker. I meet one-on-one with patients. We do programming and events. We provide financial and emotional resources and connections to peer support. We also have started an adolescent and young adult cancer survivorship clinic that's on Friday afternoons. That age range, just as a plug for any of you folks in the community, goes up to 39. So if you're diagnosed with an adolescent and young adult cancer and you are in survivorship, we would be happy to see you in our survivorship clinic, and I'm happy to answer more questions about that at the end of this presentation. Our program is also focused on research, advocacy, policy and process, and training and education. So we have our hands kind of in a lot of different pots and wear lots of different hats. For instance, we're hosting the first North Carolina Adolescent and Young Adult Oncology Symposium in April. That's April 27th for providers from across the state. Again, happy to chat more with anyone who is interested in that or wants to learn more about that. But what we've done is taken Sophie's vision and really expanded it to a much broader scope, and we're really hoping to impact adolescent and young adult cancer care across the state of North Carolina. So I want to talk a little bit about who adolescent and young adults with cancer are. As Tim said, and as you all got 100% correct on your Poll Everywhere results, the National Cancer Institute designates adolescents and young adults as 15 to 39 years old. There are roughly 70,000 new diagnoses in that age range per year in the U.S., and it is the #1 killer of people in that age range. We've seen very modest increase in cure rates in the last 40 or 50 years for this age group of people, whereas in pediatrics or in older adults, we've seen some pretty great progress in terms of cure rate. So this idea that this age group of people has unique medical and psychosocial needs has been something that's been developed over the last 10 years or so, and it's really becoming a new area of specialty and focus both for medical and psychosocial providers. We're really excited to be on the forefront of that specialty here at UNC. So that is a definition of who adolescents and young adults are sort of medically and who the medical and psychosocial community define them as. But I think it's really important to take a step back and to recognize that these photos here are really who these folks are. And this is what we try to focus on in our program here, that adolescents and young adults living with cancer have a diagnosis of cancer and are certainly going through what is probably one of the most difficult times in their life, but we want to make cancer part of their story and not their whole story. So we want to remember that these are guitar players and skateboarders, and these are parents of young children and people who are active and creative and driving change in the world, and not just focus on the fact that they're cancer patients. So we're really trying to see these folks as whole people, not just as the patients that are in front of us. So it's always important for me to acknowledge that anytime I'm talking about this age group. So just as an idea, this is kind of a busy slide. I don't expect folks to be able to really jump into all the data on it, but this is just a breakdown of the types of cancers that folks in this age range get. Now, it varies by age, right? We see a lot more. The pink bars are breast cancer, and you see many more breast cancer diagnoses in that 35 to 39-year-old age range, for instance, versus the 15 to 19-year-olds. But in general, many of the types of cancers that we're talking about this age group of people getting are leukemias and lymphomas, bone cancers, germ cell cancers, melanoma, and then as you get into those upper age range, you start seeing more of the breast cancer, colon cancer, cervical cancer, and those kinds of things. So I think it's worth talking a little bit about, and maybe folks who are listening either have a person in their life who's an AYA who has cancer, it's a neighbor or a friend, maybe it's a son or a daughter or a granddaughter, but I think it's really important to talk about what's happening in this time of life developmentally. So typically 15 to 39-year-olds, and this varies depending on where folks are in that age range, are establishing some autonomy from their parents and their families of origin. They're creating their own personal set of values and identity. They are forming really strong peer relationships, and this includes intimate partner and sexual relationships. They're obtaining preparation to join the workforce, whether that be a trade school or working or in college. And they're trying to achieve financial independence. So they're really working to build their life, and it is a time of great transition. Whether you're in this age range listening right now or you're reflecting back on what this time in your life was like, I think we can all think about how much transition is happening in that age range. You're maybe graduating from college, you're going to college, working, starting a family, and just building that life that is so important to you. So imagine what happens to that development when you're diagnosed with cancer. It's a huge stop in your sort of reel of film that's happening in your life and moving forward. And what I often will say to patients is it's much like you're driving down the highway going 60 miles an hour, and then you're asked to pull over on the side of the road, and everyone else continues to go 60 miles an hour down the road past you, and you're sort of stuck on the side of the road. And that's a pretty tough place to be. And it's also pretty tough to get back onto the road afterwards. So we're going to talk a little bit about that later. I also just wanted to provide a little bit of information about the way your brain works during this time of life. So this is often really helpful for parents who have teenagers, but the frontal lobe is the part of your brain that deals in reasoning and consequences and kind of how we think through making decisions. And that part of your brain isn't finished developing until somewhere between the ages of 26 and 28 years old. So this might be a reminder as to why you're not allowed to rent a car until you're over the age of, I think 24 is the rule there. And the same goes for this. So I think some expectations that we have of folks in this age range to be able to really think through decisions in a way that is similar to their older counterparts is unrealistic. So I want to talk a little bit about the unique medical needs that this age group of people have. So we know that the tumors and the tumor types, the cancer types this age group often gets, have very unique biology. So the difference between getting leukemia as a 20-year-old versus a 10-year-old are vast. We know that the biology and types of cancers they get are harder to treat. We know that there are often delays in diagnoses due to a variety of reasons. You may be uninsured or underinsured. We also know that this doesn't present that often for providers. So if you're going to your primary care provider and you're showing some of these signs and symptoms of a cancer, it is still relatively rare. So picking up on those cues as a provider may be tough, and we might have some delays as a result. Compliance is an issue, and it's not just, I think when I say compliance, people hear that it's an ornery teenager who's saying, well, I don't want to have my treatment that day, or I'm not taking that medicine that makes me feel sick. But it's really tough to balance life and work, and you might have young kids that you don't have childcare for, and that can impact your ability to receive cancer care. There are big-time financial issues, I think, across the age spectrum when you're talking about a cancer diagnosis and treatment. But when you're in this age range, you're often just starting out your financially independent life, and you don't have much of a backup in terms of savings to help pay for the cost of cancer care. That can impact treatment. We also know that enrollment in clinical trials is much lower in this age range. So as family members, friends, community members of folks in this age range, I would recommend that if you know someone with a cancer diagnosis, that they are reaching out to find out what clinical trials are available to them. This is really important, and it will allow them to participate in some of the more up-to-date treatment protocols that are available. Fertility preservation is something that we're going to talk about a little bit further. What I included, and you'll see on the screen, is a snapshot from a website called Critical Mass. They're an amazing advocacy organization for adolescents and young adults with cancer. And this is a printout that someone who's newly diagnosed could, for instance, take to their oncology appointment with them. It asks great questions. It's free. You download it, print it, and take it with you. On the Critical Mass website, they have a variety of resources that you can check out and provide to anyone that you know who might be in need of this. And what I love about it is that it's broken down by the phase of cancer that you're in. So are you newly diagnosed? Are you in treatment? Are you in survivorship? And you can choose from a list of resources that they have. I would highly recommend checking that website out. I want to talk a little bit about fertility preservation. So this is something that is not always discussed with adolescents and young adults, but we know from a lot of research and just anecdotally working with folks that this is very important to young people. So many of the cancer treatments that we offer to patients can impact folks' ability to have children in the future. It's very important to have this conversation at the beginning of cancer treatment. And we know that when that conversation doesn't happen at the beginning of treatment and that patients are not given the opportunity to explore what fertility preservation options there might be, that they have a lot of regret and resentment later in their life. This is a big deal. This is about your ability to have a family in the future. And it's something that doesn't always get discussed at the beginning of treatment. You may not be able to preserve fertility. Your fertility may not be impacted by the type of cancer treatment that you're receiving. Regardless of what the outcome, it's very important to have these conversations. They can be really hard to have, especially with younger teenagers who are not usually thinking about family planning. But as supporters of these folks, it's important that we remind them to check out some of the resources that are available. I included here a screenshot from SaveMyFertility.org. These have great questions to ask your doctors. They have pocket guides that you can take with you. They have assistance in finding financial assistance that's available. So it's a great place to start in terms of looking at resources for this information. So I want to talk a little bit about the unique psychosocial needs of this age group and kind of what they need as far as support. And then as we move through the presentation, we're going to talk a little bit about what does this actually look like to provide support to them, but it's important to establish some of the problem first. So as we talked about before, this is a developmental time of transition. Lots of things are happening. This age group often feels really isolated from others their age. They can't usually go to school when they're in treatment. They don't see their friends as often. Excuse me. When they're treated in the adult hospital, they're often surrounded by folks who are much older than them. When they're treated in the pediatric hospital, they often see people who are younger than them. So even connecting with other cancer patients their age can be tough. So there are a lot of feelings of isolation that I hear patients talk about, and that there's some pretty good data to support that. That's kind of something that people experience across the board. They need a lot of autonomy because this is the time in their life where they're really grasping to have control of their own life, but they also need a lot of support. I mean, anyone who's been through the healthcare system knows how important it is to have someone with you to provide support, ask questions, and make sure that you're receiving all the information. But finding that balance can be pretty tricky with people in this age range. There are a lot of body image issues that come up. Cancer treatment does not leave you without scars, both physically and emotionally. So figuring out who you are as a person while also incorporating some pretty big changes that can be happening to your body is really tricky. You oftentimes will lose your hair. Sometimes treatment requires pretty big surgeries and actual scars that will happen. So this is just, some things to keep in mind. I included fertility preservation in psychosocial needs because there are some impacts from having your fertility and sexuality challenged and changed in this time of life. How do I talk to this? How do I talk about this with potential partners and friends? What does that look like? And how do I feel comfortable sharing that information with someone that I become involved in a relationship with? So that brings me to the next thing that we often talk about with our patients in this age group is sexual partners, dating, and intimate relationships. How do you balance all of that when you're going through treatment? What do you share with people? What do you not? And what is the balance between your treatment and your cancer life and your life outside of cancer? And how do we stay as normal as possible while also knowing that this is not normal and this is not a normal thing that's happening to us? So the other thing that we make sure that we focus on is school and work needs. How do I continue to work if I need to? What does school look like, and how do we make adjustments? One of the things that I included on this page was an app through the Stupid Cancer website. So if I have you remember two websites from this presentation, it would be Critical Mass and Stupid Cancer. Those are really key places to start in terms of resources and support for patients. Stupid Cancer is was started by and designed by a young adult cancer survivor. He felt isolated during treatment. He felt like the information that was available was not directed to people his age, and he has created a fantastic resource for adolescents and young adults with cancer. They also offer an app. If you go to the App Store on your phone, your smartphone, you can download the Stupid Cancer app, which allows you to connect to other adolescents and young adults with cancer and caregivers. So we'll talk a little bit more about caregiver needs later, but this is a fantastic resource and I would highly recommend it. So I have a quote here from a 23-year-old that I've worked with, and she says, "The simplest advice I can give to facilitate conversations with adolescents and young adults is this: be respectful and genuine. We are forced to confront our mortality at a time in our lives when society tells us we're invincible, fearless, and limitless. When that construct crashes down around us and shatters, we can feel very vulnerable." I could not have said that any better myself, and I think it's really helpful to set the context. And how do you communicate with adolescents and young adults with cancer? What does that look like? So some quick points that I have for this are pretty simple, actually. Honesty is key. If you think about most teenagers and young adults, they can see through a lot of, I guess the most politically correct way to say it would be BS, right? We have to be honest with them. The internet is a big and broad and wide and easily accessible place. If we're not honest with them about their disease, about their treatment, about what's happening with them, they're going to go somewhere else to find that information. So honesty is key. And that includes, I think, sometimes just the ability to say to them, this really sucks. And of course, I want to be positive for you and I want to stay positive and I want to support you. But I also acknowledge that this is really crappy. And sometimes it's really helpful to just say that out loud. Along with that, I think it's really important to be direct. Just share kind of what you're thinking and feeling. They're going to feel it anyway. So throwing it out there is really important. Not being judgmental of the thoughts and feelings that they may express is huge. You want to avoid controlling or punitive language. So I think sometimes as adults in these folks' lives, or even as peers, when they express that they are tired of treatment, that they do not want to do any more of this, oftentimes that's coming from a place of frustration and fear and exhaustion and feeling pretty crummy. And I think sometimes our first instinct is to jump in and say, well, if you don't do this, fill in the blank is going to happen. And these folks know what the consequences of that would be. They really just need a space to process how hard this is. So giving them that space is crucial. I think helping adolescents and young adults understand how they best receive information from providers is crucial. Many of these folks have never interacted with the healthcare system before. They don't know if they receive information better by having it written down, by having it spoken to them, by having a diagram drawn out, by going to a website. This is really important. They're going to be consumers of healthcare for the rest of their lives as a result of having cancer at a young age. We need to help them understand how they best receive information and how to advocate for themselves and interact with healthcare providers. Encouraging them to ask questions and to advocate is something that's pretty tough when you're a younger person dealing with mostly older folks who are taking care of you. So helping them understand how to do that is key. Talk about things other than cancer, right? Their whole life has not become their illness. And what I hear most from people is that they want to feel normal. They want to go to the movies. They want to play sports. They want to eat normal food. They want to do normal things, and they don't want to be seen just as a cancer patient. Respect their need for privacy. I think when we love someone and they get sick, it is very hard to take a step back and allow them to have the privacy that they need. But what I often say to people that I meet in the hospital is that I ask questions like, I'm guessing that before your cancer diagnosis, you were not with your partner or with your caregiver or your parent 24 hours a day. I think we all sort of lose sight of the fact that most of us have some privacy in our life. a lot of that is taken away when we're diagnosed with cancer. So don't be afraid to ask if the loved one that you know wants some privacy, and give that to them. The other thing that I think is really important to talk about with folks is what they want shared on social media. Oftentimes I work with patients and families who have some conflict about what one family member is comfortable sharing on social media versus what the patient is comfortable sharing on social media. These are usually things that can be worked out pretty easily as long as that conversation happens in a transparent way. So I encourage families to have that conversation at the beginning of treatment so that, for instance, mom isn't sharing every detail of treatment while the patient is feeling like they want a little bit more privacy and not as many things shared on social media. One thing to think about, I think, is how do we give this age group more control over their lives when they're in treatment? As we discussed earlier, a hallmark of this developmental time in life is that you're getting more control and autonomy over your own life and decisions. Cancer comes along and a lot of that is taken away. So I think it's important to think about, how do we give more control? What does that look like? Can we allow people to choose the food that they want, the schedule that they have? If they have to be admitted to the hospital on a Monday, but there's a big football game at school that they really want to attend, can we push that admission date to Tuesday? Is there a work presentation or trip that they need to make, or a shift that they need to be at? How can we be flexible and help them advocate for that balance of normalcy and cancer treatment? What does their room look like in the hospital? Can we bring things from home to make it feel a little bit less like a hospital room? Are there activities that they may or may not want to participate in that we can just give them control over and say, you know what, we trust you to make that decision yourself? Decision making is huge. We need to involve them in decision making. We need to make sure that they understand their diagnosis and treatment and that they have a say in how they're being treated. This is really important. Involving their peers is huge. Who are the important people in this person's circle? Is it grandparents, parents, partners, spouses, girlfriends, boyfriends? What does that look like? And how do we involve them in their medical care? How do we encourage them to be a part of the process? Because we know those are the people that they're going to go home to at the end of the day. So if you are listening right now and you are a part of that circle for someone, I would encourage you to ask them how they want you to be involved in their care. Maybe they don't want it at all, but I think it's important to have those conversations. Physical activity is another option too that we often take away from folks and say, you can't play basketball, you can't play football, you can't do these contact sports because of the risk that there is to you during treatment. But what can they do? What is fun for someone in that age range to keep moving? We know there's a lot of great research about how important physical activity is during cancer treatment. So this is just a quick note about age-appropriate activity. So when you think about things that are happening at this time of life, as I mentioned, physical activity, hanging out with friends, drugs and alcohol are often a part of life at this point in time. And what does that look like and how does that interact with cancer treatment? Attending school and work functions, having some time alone, as I said. One thing I'll say about this specifically is that if you're the person that you're supporting through cancer treatment is interested in some recreational drug or alcohol use, it's really important to have conversations with their medical providers about that. So encourage them to talk with them about that. This is a really normal thing for folks in this age group to participate in, but they need to understand what the risks are if they're using those substances while in cancer treatment. So again, I think it's a lot of this encouraging communication, open communication between providers and patients. So I want to talk a little bit about what it's like to be the caregiver of an adolescent or young adult with cancer. This is from a 26-year-old wife of a patient that I worked with who said, "I never imagined my days and nights would be filled with insulin shots, IV ports, steroids, lots of fatigue. There are new things that I learn every day, and I wonder if I'm up for the challenge, if I'll do a good job, if I can handle the pressure." So these are often young people taking care of young people, and I think thinking about how we best can support them is very important. So the uniqueness of the AYA caregiver is that it could be a spouse, a partner, a friend, a parent, a neighbor, a sibling, a grandparent. It really spans so many different types of relationships in life. There are great websites and supports. So as I mentioned before, the Stupid Cancer app is a fantastic support for caregivers as well, where they can connect with other caregivers who are taking care of AYAs. Instead of just asking for help, what I'll often say is find someone in your life who can be an advocate for really gathering the folks together who want to provide support to you. And a great way to organize people is with a website, for instance, like Lots of Helping Hands. This is where you can sign up for meals, for taking people back and forth to the hospital, mowing the lawn, walking the pet. There are lots of different ways that you can support people in this situation. It's really helpful to have kind of a point person outside of the caregiver and the patient who can run a website like that. I think one of the things that is really important that I see quite often is that we need to be respectful of relationships regardless of how young they are or the permanence of them. So oftentimes a relationship with a girlfriend or a boyfriend is dismissed as not being that important when that might be the most important relationship in that young person's life, and we need to be respectful of that regardless of if they're married or how long they've been with that person. I think that the isolation factor is not just an issue for patients, but also for caregivers. So how do we introduce them to other folks their age? And I'm always happy to try and facilitate those connections. But as I said, the internet is a pretty fantastic place when you look at it the right way and through a certain filter. And there are a lot of great supports for caregivers so that they don't have to feel as isolated when they're providing support for folks. So this is just a note and another plug to remind people who you may be connected with who are going through this process that there are some legalities that are important to discuss at the beginning of treatment. So anyone over the age of 18 can designate a healthcare power of attorney, and that's really important for adolescents and young adults to think about who they would want making decisions for them if they can't make those decisions for themselves. And it's crucial that those conversations happen early on and that they happen very transparently and that the healthcare team has that paperwork and knows who that person is. It might not be a parent, it might be someone else, and it's important to have that conversation. I think it's also crucial for people who are accompanying adolescents and young adults to their appointments at the hospital to expect that the provider is going to ask to speak to them by themselves. This doesn't mean that you can't be trusted, that you are not wanted in the room. But again, when we think about what's appropriate developmentally, it's appropriate for folks in this age range to have independent conversations with their healthcare providers. So if that's not happening, I would absolutely advocate for that in your healthcare setting and with your providers. One other thing that I think is really important to discuss, regardless of what the prognosis is or how your cancer treatment process is going, is to think about advanced care planning. Many of us don't think about these things until we're much older. Unfortunately, as my patient who we quoted a few slides back said, this idea of infallibility or that you're invincible is now gone for a lot of these patients. And having conversations about what they want when certain healthcare situations arise and what they might feel like are important is really important to them. They want to be able to make sure that their voice is heard even if they can't express that in the moment. So I included a young adult advanced care planning guide. It can be found at agingwithdignity.org. It's called Voicing My Choices, and it's a great tool for patients and caregivers to use. They can fill it out together. Happy to answer any additional questions about that. I think this is a good tool regardless of where you are in your cancer process. So just a quick note about parenting with cancer. This is one of our patients here and his daughter, and it's really key to talk with kids about cancer. So if you know someone who has a small child or even an older kid, and they're going through the cancer treatment process, it's really important to speak with them about what's going on. And in many of the same ways that we suggest communicating with adolescents and young adults. We want to be honest and direct and age appropriate with the information that we give them. but we want to give them that information as soon as possible. We want to name it, so you want to use the word cancer and say, mommy or daddy or whoever has cancer. We don't want to just say that they're sick. Lots of people get sick in the world. If you can't hear now, I have a cold right now. We don't want kids to be confused about sickness versus cancer and what can happen and how seriously ill people can be when they are being treated for cancer. So it's important to use that word. And I know there's a lot of fear associated with that, but kids respond really well to honesty. And if you have healthcare providers at your institution, social workers, child life specialists, who can help you with this process, I would absolutely recommend reaching out to them. We'll get to some resources at the end of the presentation that you can check out online as well about how to have these conversations. I think the other thing to remember is that it's okay to show emotion when you're having these conversations with kids. This is hard. It's going to be hard for them, and it's okay for them to know that it's hard for you. You want to encourage them to ask questions, and depending on the age, you're going to get all kinds of different questions. And we also want to let them know it's okay for them to have emotional reactions. It's okay for them to be angry or sad, or to just say, okay, thanks for that information, moving on, let's go play something else, right? There's a lot of developmental differences in how you talk with kids, but just wanted to make sure that we talked about that a little bit today. So I want to briefly talk about transitions in care, so whether that be into cancer survivorship, or with a relapse of disease, or at the end of life. And I included this photo of a roller coaster, but it looks like a roller coaster that would personally make me barf. It's just like up and down and around and spinning. And I think that this is a great example of what I hear people say that cancer treatment is like. And there's another quote that I included from the Stupid Cancer website that says, cancer, depression, and PTSD go hand in hand and are hard enough to bear when you're told to just be positive. So I think it goes back to, I think as loved ones of people who are going through a cancer process and treatment, we want to be as positive and as encouraging as possible. But what I hear the most from adolescents and young adults is that they wish people in their life would acknowledge that they can be positive and we can focus on positive things, but that they wish people would also just acknowledge how much this sucks. So I think, and the reason that I have this here when we're talking about care transitions is that although cancer survivorship is something that oftentimes is celebrated and is a very exciting time for people to finish treatment and make it to the survivorship phase, it's also a time that's very scary. And it's a big transition from actively treating and fighting cancer to just cancer surveillance and watching to see if disease is going to come back, but also that their life has really changed. And what does that look like? And how do I get back on the highway that we talked about earlier? When everyone else is going 60 miles an hour, I don't really know how to speed up and get back on the road. So it's a time of uncertainty, even when the news is good and there is a lot to celebrate. So just remember that as you're supporting people in your life who are going through this process, that these transitions into different parts of care can be sad, they can be really anxiety producing, they can be stressful, they can be exciting. So it's a mixed bag of things, and I think it's important to remember that so that we can support people as best as possible. So if you haven't been paying attention and you want to tune in right now, these are the key takeaways from the last 40 minutes or so, is that these are the things to remember when supporting adolescents and young adults with cancer. We want to promote normalcy as much as possible. We want to promote honesty among friends and family, among providers, among other caregivers. We want to promote connections to friends and peers and to the life that they had before cancer. We want to have realistic optimism, so talking about being positive, but also talking about the reality of how hard this situation can be. We want to give as much freedom as possible and as much as freedom as they want. And we want to make sure they have the amount of education that they need so that they can be appropriate and effective consumers of healthcare. So I have a list of resources here. These are all great websites to check out. They'll be available in the PowerPoint presentation. They're sort of grouped by topic. Feel free to explore them. But again, I think great places to start are Stupid Cancer and Critical Mass. They'll get you to a lot of these other options that are here. And I just want to say thank you so much. We can leave that resource page up, or we can leave this up for question and answer, whatever works.
Sure. Let's go ahead for a few minutes and leave that resource page up. And then that is available on the website, unccn.org. If you go and find Lauren's presentation, you'll see the slides and you can download those. And you'll also, in just a couple of days, you'll be able to watch this video, and that'll be available.
And I'm also always available to answer questions. I'm not sure if my email is connected to any of this, but feel free to reach out to me at any time. I'm happy to help with anything I can. Great,
thank you. And I'm not sure if we posted your email or not, but if you send anything for Lauren to uncn@unc.edu, we're certainly happy to forward that on to you.
Yeah, and I don't think I included our UNC AYA program website, but that has all of our contact information as well. So if you just Google UNC AYA program, you'll find that as well.
Great. Well, I wanted to leave that page up longer, and then I realized I'd better move forward to our Q&A page. So just a reminder, if you joined at the beginning of the presentation, then you can just start firing off your questions either via the polev.com/UNCCN website, or by, and if you didn't do it already, you can do that now. Text to the number 22333, the letters UNCCN one time. You'll get a join message, and then you can go ahead and start sending questions for Lauren. I've learned a lot. This has been very informative. I wrote down, first a comment and then a few questions. You mentioned Smitty, Dr. Smitherman, and I just wanted to let our audience know that Dr. Smitherman was here in April 2017 for one of our community college lectures.
Oh, great.
And so that is online in our lecture library, and if you're interested in that as well, that is available.
Great.
All right, so we've got a question coming in already. Our AYA and family misses our caregivers and felt a bit lost after. Looks like we got the first half of a question, so please feel free to give us the second part of that question so that Lauren can address that. Let's see. One thing, I had a number of questions. One, I wondered, I'm guessing there are also some unique characteristics as people in the AYA category go beyond 39 and into their 40s or 50s or 60s. Are there some unique characteristics that these individuals share
as survivors?
As survivors,
yes. Absolutely. So we definitely know that, and this is where I think having Smitty here would be great because this is his specialty. But I would say that there are definitely unique needs that adolescent and young adult survivors have depending on the type of treatment that they received. So we know that certain types of cancer affect your heart or your lungs or your hearing or your vision or things like that, your cognitive ability. And we know that there are some great guidelines that we use in our survivorship clinic to suggest surveillance and interventions for those folks. So I would say get plugged into a survivor clinic, and what you will do is get a survivorship care plan that is unique to you and your treatment.
Okay. Great, thank you. Question, is there any possibility of hospitals offering something like AYA?
So I'm not quite certain about what that question is asking, but I think
maybe services like what
we offer here.
Through UNC.
So I think that there is definitely a great opportunity across the United States for more hospitals to offer adolescent and young adult cancer support programs. There are, I would say, about 20 of them popping up across the U.S. Some are a little more established than others. Some are really new or just in the planning phases. What we do know is that a lot of folks in this age range are not treated at large academic medical centers, right, like UNC. And one of the things that we're interested in at UNC is how do we expand our reach across the state, and how do we provide better services to adolescents and young adults who aren't treated here with us, who are treated closer to home, right, where they don't want to have to drive 2 or 3 hours to come here. And what does that look like, and how can we work with those places to provide different and unique care? So it's a great question and something that we're really interested in developing here. Right.
And I know you mentioned wanting to expand the Allow Sophie Foundation's work throughout the state. So would that be included as part of the work that you're focusing on? Okay. Other questions? We've got just a couple of more minutes, so please, if you have any other questions, text those, or through the POLAB website, go ahead and let us know those questions while there's time. What, in terms of groups that people in the AYA community can reach out to for peer support, what are some of the things that are available, whether it's an online group or a face-to-face group? I know you mentioned, you had said critical mass and stupid cancer were the two sites to remember, if no others. Would those be good resources for
those
finding out?
Those are great resources. There are a couple other things that I'll mention. One is an organization called Adolescents, and they do outdoor adventure programs for AYAs who have been diagnosed between the ages of 18 and 39. They are fantastic. You can go on free week-long rock climbing, surfing, skiing, kayaking adventures with them. The cost is completely covered. They're an amazing organization. We run a program with them each fall where we take a group of our UNC patients to Pilot Mountain for a long weekend to do rock climbing. And the idea is to get people moving and living out in the world again. So they're a great organization that I would suggest. The other thing is Stupid Cancer runs a cancer conference called CancerCon in the spring. I'm not going to be able to tell you exactly when. It's usually in Denver. If you go to their website, you can find out more information about it. It's a great, and it's a patient conference, so it's not for providers. It's for patients to go and learn about care and meet each other and do fun stuff. So CancerCon is a great opportunity as well.
And I'm guessing that people who go to these maintain some of the relationships they develop there through social media, even if they're not in close proximity to one another, and that can be extremely important. A couple of other questions. Are there AYA specialists who help offer continuity of psychosocial care?
That's a great question. So I think that this is a new-ish field if you think about it kind of in the context of cancer care. And I think that every AYA program that's popping up around the United States are sort of building it out in different ways. So some have psychosocial providers like an AYA life specialist or child life specialist or a social worker or a psychologist. Some have focused more on the medical side of things and are starting off with a medical care team, and some, like us, are doing kind of a hybrid. So there's definitely opportunities in that world. I'm happy to talk more about that if someone wants to be in touch with me.
Great, thank you. And we'll take our last question here. Sorry, are there AYA life specialists who? Oh, okay. So never mind. All right. So I do think that brings us to the end of our questions. I want to say thank you to the North Carolina General Assembly for their generous support of UCRF, or the full name is the University Cancer Research Fund, and the important work done by the UNC Lineberger Comprehensive Cancer Center. I want to thank Mary King, Veneranda Obore, and John Powell, our team, for all the hard work they do day in, day out to make sure that today's program and so many other programs, over 40 different lectures every year, are available. So, and then we want to remind you of the Learning Portal. So this is new UNC Cancer Network Learning Portal. It's at learn.unccn.org. And this is a great resource for seeing all of our lectures and for finding, specifically if you're taking some of our 4-credit lectures, you're now able to go back, not just get credit during the time of the lecture, but anytime within a year of the lecture. Now, this particular Community Lunch and Learn series is not part of that, but there are lots that are. And then, as I mentioned earlier, our library, if you go to unccn.org, you can find our library of over 200 lectures. And there's just a little bit more information on our learning portal. Again, learn.unccn.org. And I want to let you know about on February 23rd, our presenter is Dr. Gaylord, Dr. Susan A. Gaylord, Stress, Inflammation, and Cancer. That will be our next Community Lunch and Learn program. So we hope everyone will join us for that. Please spread the word. Again, unccn.org. You can find just about everything. We're on Facebook, Twitter, YouTube, etc. So, Lauren, thank you again. We really appreciate you being here. This has been a terrific discussion, and we look forward to seeing everyone next month or at one of our 4-credit lectures coming up soon. Thank you so much.